The cold weather might have you feeling tired or down in the dumps. On today's Healthy Living, naturopathic doctor Jacqui Fleury is telling us about a deficiency that could be the culprit. Good morning.
Good morning. Thanks for having me.
Thank you so much for being here. So tell me a little bit about this deficiency that many people might be facing at this time of year.
Well, I think most people know about vitamin D. They're either taking it or have been advised to take it by their doctor or a healthcare advisor. But I think it's really important to understand that this time of the year, we're really not being exposed to the sun, and we're not getting much for light, natural light at all. So by compounding the deficiency of vitamin D, maybe not supplementing enough, and then not getting any sun, it can really cause us to feel tired and kind of brain foggy, and sometimes even really low mood or even depressed.
And I know this is also good for, taking vitamin D is good for things like immunity. What else is it good for?
Well, definitely important for bone health. It's definitely important for gut health and brain health. Remember, vitamin D is a hormone. It's not actually a vitamin. And most people that I encounter in practice either know about vitamin D or are supplementing it. But I think it's really important to understand that vitamin D, because it is a hormone, you can be taking too much of it and you can be taking not enough of it. So there is a bit of a sweet spot in terms of that blood value of your vitamin D. And it's a simple blood test to do.
And of course, in the wintertime in general, you know, you might just feel a little bit down, a little tired. At what point do you think it's a vitamin D deficiency? What are those signs that you should look out for?
Well, it can be energy for sure. It can sometimes it can affect your digestion, and sometimes you can just feel achy, like your muscles might be achy, or you might just feel like you're walking around in a fog. So those would be common symptoms. But it often, it's not obvious that you have a vitamin D deficiency. So we just assume as healthcare practitioners that everybody needs it, so that there's just a general recommendation to supplement, you know, maybe 1 or 3 capsules a day. But I definitely find in practice when we do run those blood levels that very few people are actually in that sweet spot. They're maybe on the low end of normal and sometimes on the high end of normal or even above reference range. So it is, like I said, I can't emphasize enough, there are many supplements that people take and they may not know whether or not it's making a difference, and there isn't really a good test to confirm that one way or the other. Vitamin D, there is a very simple blood test that will tell us whether or not we're in that sweet spot.
So tell me a little bit about that testing process and just how important it is to know your levels.
There's a couple of different ways to test. So here in Saskatchewan, you can ask your medical doctor to run that test on your behalf. And sometimes doctors may or may not want to do that, and that's fine. You can also access a blood spot test, so you can access that as an at-home test that can be ordered online, or you can access it through my clinic, for example, or other healthcare providers who know about these blood spot tests. So I guess my recommendation is, if you really want to be proactive with your health and really want to take charge of your supplementation, this is one of those blood values that really help you to customize your supplementation in this respect.
And how important is it to combine your vitamin D with K2 to make it more effective?
Yeah, that's a great question. Vitamin K is like a partner with vitamin D, and vitamin K helps to direct the calcium to your bones. So calcium is important to supplement, but it should never be done in isolation. So calcium plus vitamin D plus vitamin K, obviously plus a healthy diet. We never want to underestimate the importance of eating well, but it's really hard to optimize these levels in your diet without supplementation.
Well, thank you so much for all this information today. I think it will be really useful for a lot of us here. Thank you so much.
My pleasure.